What do you do if you're tested positive for COVID-19 and need to self-isolate at home? A majority of those who are infected are currently doing home quarantine. But what's worrying is that there are more and more patients who are brought in dead. To avoid that from happening to you, what do you need to look out for? But first, let's address who gets to self-isolate at home. According to KKM guidelines, patients who fall under Category 1 and 2 can home quarantine, taking into account low risk factors. That includes no comorbidities, having a suitable home and a caretaker, and those who are less than 60 years old. Typically, once you're infected with the virus, you're then required to walk into any COVID assessment centers to be screened by doctors, who will then determine your suitability and decide where you should be quarantined. So, if you're doing home isolation, what do you look out for? Number 1, your oxygen levels, which in this case, a pulse oximeter will come in extremely handy. Normal oxygen levels are 95% and above, and a normal heartbeat is 50 to 90 per minute. If your oxygen level drops below 95%, that is a warning sign that your condition is worsening. A key thing to remember is, as soon as you notice any difficulty in breathing, that's when you should seek help immediately.
Now, the thing that you need to keep a very close eye on is if there are symptoms that are getting worse and it's affecting how you do things, particularly if it's to do with your breathing. So if you become more breathless, if walking up the stairs suddenly becomes an effort, when yesterday it was absolutely fine, it's an indicator that your body is struggling.
I'm sick.
Here are the other symptoms that are warning signs that your health is deteriorating. That includes persistent fever, shortness of breath, and chest pain, out of many. So, what can you do to take care of yourself or a person who is self-isolating at home? Drink plenty of water to stay hydrated and eat a balanced diet if possible by getting the right vitamins in. Treat your symptoms if there's any, such as taking paracetamol to bring your fever down or taking lozenges if you have a sore throat, things like that. Frequently check your temperature and oxygen levels and record them on a table such as this. Keep a close eye on your symptoms that could show vital signs, as mentioned earlier. Use an inhaler with a spacer if needed. If possible, keep your room ventilated with lots of fresh air, and always maintain some degree of physical isolation or physical distancing if there are other people in your household. Any sort of physical barrier between you and them would be helpful. There's also been exposure on the proning method, which healthcare professionals typically do on patients who are lacking oxygen supply.
Essentially what you're doing is you're allowing different levels of blood flow and different levels of ventilation or airflow into a different part of your lung.
So, in proning, you switch between these 3 positions every 30 minutes. Laying on your belly, laying on your right or left side, and sitting up. Make sure that you're comfortable throughout.
When you're lying down, you're essentially allowing gravity to help get things to the back. When you're doing it forward, allowing the back to actually expand more.
But again, if you do experience difficulty breathing, you should seek help immediately.
The virus is the cause of lung injury, and people then have a situation where, because things are so swollen, oxygen cannot penetrate. You can't absorb oxygen the way you normally would, and that's where you become breathless, that's where you need oxygen support. But essentially, if you're category 1, 2, 3, any form of regular exercise that allows to improve your respiratory function is going to be useful. So things like yoga, tai chi, pilates, gentle brisk walks, anything that allows you to breathe deeper, that is going to be helpful.
Some of us have been buying our own oxygen concentrators too. But Dr. Helmi advises against relying solely on it, as we might be missing out on other treatments that we would be getting if we were in the hospital. Our health minister is also urging family members and friends to frequently check on COVID-19 patients that we know who are undergoing home quarantine. Video call or text them and ask them about their health conditions, as situations could deteriorate very, very quickly in a short span of a few hours, as seen in many cases.
You get to a point where there is this release of chemicals in the body that deal with the process of inflammation. Things suddenly become a lot more inflamed. And then what happens is that part of the lung is supposed to absorb oxygen. It becomes unable to do so. So you can deteriorate relatively quickly.
Oh, and ivermectin?
As of now, 24th of August 2021, there isn't any strong, clear evidence to suggest that ivermectin helps prevent or treat COVID-19.
Oh, and the vaccines? They work. I'll stress this again. Key indicators to seek help immediately are when one experiences difficulty breathing and a drop in oxygen levels. And there's the mental health aspect that we don't talk enough about, as the virus can be extremely isolating. Do check in on your family and friends to see if they're okay. A simple question of "How are you feeling?" or "Is there anything that I can do for you?" could mean a world of a difference for them.